Welcome to the ADHD Women's Wellbeing Podcast. I'm Kate Moore-Youssef and I'm a wellbeing and lifestyle coach, EFT practitioner, mum to 4 kids and passionate about helping more women to understand and accept their amazing ADHD brains. After speaking to many women just like me and probably you, I know there is a need for more health and lifestyle support for women newly diagnosed with ADHD. In these conversations, you'll learn from insightful guests, hear new findings and discover powerful perspectives and lifestyle tools to enable you to live your most fulfilled, calm and purposeful life wherever you are on your ADHD journey. Here's today's episode. Welcome back to another episode of the ADHD Women's Wellbeing Podcast. And I'm here today to discuss something really exciting and something I'm personally very interested in. I'm always doing these episodes so I can share this information and give you that empowerment so you can make choices, do your own research, and then hopefully as things filter through the more holistic side of managing our ADHD, you're able to make those choices further down the line. And today I'm absolutely delighted to welcome Dr Niraj Singh. And he is a consultant psychiatrist and specialises in neurodevelopmental psychiatry. And he has extensive experience in treating adults with ADHD, mental illness associated with autism, intellectual disabilities, as well as other mental illnesses. And he also specialises and has extensive experience in medical cannabis treatments, which is what we're going to be talking about today. He has a special interest in health span, longevity, and practices holistically, focusing on nutrition, exercise, sleep, and other areas to optimize mental health. This is all my language. I love it all. Anything that we can bring more holistic practices into helping our ADHD is what we're here for. So Dr. Niraj Singh, welcome to the podcast.
Thank you, Kate, and a pleasure to be here. Thank you for inviting me.
Yeah, so I'm really intrigued to talk about medical cannabis for the treatment of ADHD. We're talking here, we're both based in the UK. I know you're based in Leicester and in London. You have a consultancy that specializes in this and is prescribing medical cannabis. And I think a lot of people are going to be like, ooh, okay, I'm interested, but cautious. And I've heard this and that. And maybe we can just demystify lots of things. And the fact that you are a psychiatrist, neurodevelopmental psychiatrist, this is something that we need to understand and know about because there are other options out there. So can you tell me a little bit about maybe your experience with delving into this side of psychiatry?
Yeah. So I've been a psychiatrist for about 20 odd years now and a consultant, I think for the best part of 15. And the reason I got into this, Kate, was because I was reaching points where my patients weren't getting the outcomes that I wanted for them. And so I just researched and I found medical cannabis. It churned from a Schedule 1 drug with no medicinal value to Schedule 2. And I actually realized that this was actually within the scriptures, ancient scriptures, Chinese and Indian as well. And actually it's always been in medicine, in spite of the fact that we've been conditioned or taught that actually it can cause a lot of problems. So in medical school, actually, I was taught that cannabis is a really bad thing. It has no medicinal value. It actually causes schizophrenia and other things. Really what I found was actually, this was a potential option for my patients to really benefit them. And also in a holistic sense as well, because it's a plant ultimately, many medicines within one.
So what's interesting is that obviously you were trained traditionally in medical school and you're hearing the things growing up. There was apprehension. I grew up and knew quite a lot of people that smoked cannabis. Very often it was that gateway, or it had detrimental impacts on mental health, and it caused, anxiety, depression, things like that. What we're talking about is very different. And I just want to make that distinction. And what's very interesting is that you, as a doctor, are recognizing the sort of the natural benefits of medical cannabis and how we can harness it and use it. I know a lot of people also that were diagnosed later on in life with ADHD and used cannabis to self-medicate because they recognized, despite the other things, they recognized that there was a calming impact. It helped them sleep, the restlessness, the hyperactivity, it helped calm things down. So are we harnessing that side of it to help our ADHD symptoms?
Exactly. And a lot of people, as you know, Kate, do self-medicate with cannabis across the whole spectrum of mental health problems. ADHD, people with autism who may be suffering from anxiety as well. a whole raft of problems, really. We term it self-medication because literally that's what people are doing, really, because they want help with their attentional control. They want help with emotional regulation, and the inner restlessness that they might be experiencing, and also sleep as well. And how cannabis works is it works on our endocannabinoid system. So actually, we all have cannabinoids inside of us already. A lot of people don't realize that actually we already have cannabis inside of us. These are called endocannabinoids. We have a system called the endocannabinoid system. And that's a fundamental neurotransmitter system which underpins all our other systems, be it our neurological, our gut, our immune system, our heart, our lungs, our hormones, are all underpinned by the endocannabinoid system. So if you can influence the endocannabinoid system, you can bring a term called homeostasis or equilibrium into your mind, body, and spirit. And that's historically why cannabis has been used as a medication. And yes, absolutely, it can also be very detrimental for people who have access to it on the streets, principally because over the decades, that has been filtered out to be very high, what's called THC. So one of the major cannabinoids called THC. Now, literally, if you strip the plant of a lot of the balancing components and leave it as high THC without the other components part of it, things like terpenes, flavonoids, or CBD, etc., that could potentially be quite detrimental as well. As he's rightly said, medical cannabis is different because it's produced under good manufacturing practice or GMP. So we know what our patients are getting when we're prescribed, and then therefore we can, accordingly titrate. We understand what the cannabinoid concentrations are. Compounds called terpenes as well in there, which are really, really medicinal. These are things that we come across every day. So we understand through what's called certificates of analysis, which comes with these products, how this may potentially benefit our patients, and accordingly make adjustments, as we do with any medicine, really.
And it's so interesting, isn't it, that, for historically, amphetamines have been part of the treatment for ADHD. Yeah. And that's always had still, oh gosh, I don't know if I want to take that medication because it's a drug, it's amphetamine, and it's essentially speed. And now we're going back, like you say, this historic, this ancient way of calming our nervous system, calming this endocannabinoid. Is that right?
Yeah.
Yes, endocannabinoid system. Yeah. And so am I right in saying that the endocannabinoid system, cortisol impacts it? And so if we are helping that, we're reducing the cortisol levels.
It helps regulate the whole hormonal system as well. So like I said, you've got to think of it as like a foundational system, a foundational, what we call neuromodulator system. So we have the endocannabinoids, which are the internal cannabinoids. What the plant cannabinoids are, and we love technical jargon, it's called phytocannabinoids. It's the plant cannabinoids and these are basically analogs of what we got, so similar to what we've got in our system. So by getting them into our system when we're unwell or suffering from physical or mental distress, we can bring that balance back, bring that regulation back, be it in our hormonal system, our gut, our immune system. So cannabis actually influences a whole host of systems. So typically what we have are medications which can be really helpful, but they're symptom specific. So if you have a symptom, you have a medication for that symptom. Yeah. What cannabis does is gets much more to the foundation. And that's why it works for people. That's why people self-medicate, because actually they find it works well for them in that respect.
Okay. So if they've been prescribed ADHD medication and they're noticing that, yes, it's helping them with their focus while they're at work, they're keeping them on task, they can start tasks, finish tasks, organize, it helps with their executive functioning. But the side effects afterwards, there is a bit of a kind of a way up. And some people kind of think, you know what, I don't love that feeling afterwards. And is this a long-term solution for me? Would you say this is an alternative, or can you take it alongside the amphetamine sort of stimulant medication?
Yeah, it's a great question. And the answer is yes to both, actually. So to qualify for medical cannabis, you need to have had at least 2 licensed treatments. Yeah, many patients that have come will have tried, methylphenidate, short or long acting, maybe non-stimulant medication as well, and then come to explore medical cannabis. When I mentioned about medical cannabis influencing the foundational of the system, so what it does with the endocannabinoid system has effects on the dopamine, the noradrenaline, and the serotonin circuits, but much more to the foundation. Yeah, Whereas simplistically, amphetamines help with the production of dopamine, noradrenaline, and serotonin in the prefrontal cortex, hence to get benefits with the executive functioning. Some patients want to substitute it and just change across altogether, but some people actually want to have both alongside. And actually, what I found in patients is that they can both work synergistically and work together.
Mm-hmm.
Not necessarily it's taking it at the same time, of the
Yeah.
day. Literally, people might have a gap, but use them, but actually find that they're mutually beneficial. And it's not an either or. And I think it can work in either way. Some people just want to move away from stimulants altogether, and that's absolutely fine. So it's really to the discretion of the patient themselves and what they feel they want as an outcome. But certainly, cannabis itself, with caution, and we have to hasten to ask, it generally works actually well with a lot of other medications and can work synergistically with minimal adverse effects. But obviously, we need to explain that actually no medication is side effect free. There's always potential for that. But when you compare it to a lot of other medicines, we're not having to do the vital observation checks, the blood pressure, the pulse rate, and that sort of things that we would have to do with stimulant titration on a regular basis as well. Dry mouth and dry eyes are very, very common side effects of cannabis, but that's a tolerable side effect when you compare it to potential advantages, if you see what I mean.
Yeah,
And,
absolutely.
and there are potentially other side effects as well, but they tend to be far, far, far rarer. Things like low blood pressure, nausea, headaches, faster heart rate, that sort of thing as well. So as a medicine, in my clinical experience, it's very well tolerated as well, and so that actually can be used with other medication too. So yeah.
Yeah, and what's interesting is obviously you can prescribe as a psychiatrist, so you're able to say to your patients, right, I can see you're on this stimulant or in this medication, and there's a way of like balancing the both and saying, right, you can take that in the morning to get all your work done, and then as that fades away a little bit, then you're able to then bring in the cannabis side and help. And I mean, for me, it's a no-brainer that we should have this more holistic option for people. I'm guessing that a lot of people are using this for anxiety, for overwhelm, for low mood, for sleep. What other things are people coming to you and they're curious about the medical cannabis to help them?
So I've used it for a whole host of different mental health problems. So people struggling with anxiety mainly. So that's the
Mm.
main complaint that we tend to see. But it could be people suffering from PTSD, so post-traumatic stress, complex PTSD as well, insomnia, OCD. I've also used it in people with Tourette's syndrome, people struggling with autism and anxiety, and more recently, actually, people with dementia as well,
Wow.
which is incredible. So that's mainly kind of high CBD,
Yeah.
a little bit of THC in there as well. But what I found is actually, particularly for people who might be suffering with significant anxiety, and dementia is associated with quite significant anxiety, it can help bring that down quite significantly.
What about things like Parkinson's or chronic pain, um, any autoimmune conditions? What kind of would that be something that they could use it for?
Yeah. So I don't. I mean, my colleagues would see somebody might be suffering from chronic pain and Parkinson's. So they tend to be seen by Parkinson's. I've seen something like a neurology colleague or somebody specialising in neurology. But yes, it works. Can be helpful. So it does work with for chronic pain. It can. There is evidence to show that actually for Parkinson's symptoms, things like the cogwheel rigidity, the tremors, that side of things, actually that can help alleviate it as well. And actually things like obviously Parkinson's associated with depression and anxiety as well. So it can help, and dementia too. So actually it can help across a whole raft of problems. Autoimmune, what is it? Is an interesting one. I'm not too sure about that one, but
Yeah, I'm thinking about inflammation because what I'm hearing a lot of from a lot of people I see and speak to,
yeah,
there's always co-occurring physical conditions. And I'm sure obviously you know that. And sometimes it's like the pain or it's the fatigue or there's IBS or migraines, lots of hormonal issues for women especially.
yes,
And
yes,
and they're feeling a little bit like lost because there's not many options out there, or they've been passed from pillar to post, and a doctor says, well, you need to do this, and everything's separated.
Yeah,
And, I'm very into the brain body connection. The amount of different doctors I've been speaking to now are like validating this, that this, it's all neurodevelopmental. It's this neurodivergence. We're going to understand further down the line that this is not just an executive functioning or a working memory issue. We're talking about a whole encompassing, and this is what I'm interested about with the medical cannabis, is that this could potentially help a host of different things. And so say we are struggling with anxiety, well, then if we're reducing the anxiety, maybe we're reducing the inflammation or the stress in our body, which then reduces the chronic pain and the gut issues. And just interested to hear your perspective.
absolutely. So cannabinoids themselves are actually very strong anti-inflammatories. Yeah? And as I said before, when you influence the endocannabinoid system, you influence the immune system and the gut. Yeah. So we know about the gut microbiome and the link between the gut and the brain. And as you said, Kate, the mind and body are one, right? They're not separate. We think of, in sort of current practice, we have distinctions between mind and body, but actually it's one ecosystem. Ultimately, is one ecosystem. And inflammation, and we're learning more about how inflammation is associated with disease itself, be it physical or mental. So depression, anxiety, etc. These are inflammatory conditions. Yeah. So what do we do with those? We need to have something which can bring down that inflammation. And that's where cannabis works in one way, is actually THC and CBD are actually strong anti-inflammatory compounds.
Okay. So this is, for me, this sounds like this is the future to caring for a lot of these neurodevelopmental kind of conditions. Why is it only just coming out now, especially like this is like being used for thousands of years? What's
Yeah,
the turn in the tide, and what can people expect further down the line?
yeah, yeah. So this is all stemming back to the 1950s, started leading up to sort of prohibition, which started in the US. It came on the back of the lifting of alcohol prohibition. So cannabis became a big target. But prior to that, was used as a medicine, like I said, for thousands of years. It was brought to the UK by Dr. William O'Shaughnessy in the mid 1800s. Queen Victoria famously used it, I think, for her menstrual cramps as well. And it's been hundreds of papers were published even before the prohibition of it. And I'm not discounting the fact that actually people have suffered from what they've accessed in terms of cannabis on the streets or wherever, what we call the legacy market, because ultimately they don't know what they're getting and it can potentially be poisonous. However, what's happened then is people have been taught that actually this is only a harmful drug and actually has no medicinal benefits at all. And that's indeed what we get taught as well throughout what I was taught at medical school. But I think the tide is starting to shift now, and there is certainly more openness. I think there is a reluctance for colleagues and some doctors to look at prescribing it because they're naturally worried. They're naturally worried about what might happen in terms of consequences. Are they going to cause any harm to the patient? The first rule is do no harm, right? We don't want to cause that. And, but what I found, and I found it with trepidation, I was really worried about doing my first prescription when I first did it. But I'm so glad I did, and I had excellent support with me. And all I can say to would-be prescribers is that you will be supported throughout the process. It's trying to basically unlearn the stuff that we've already learned and been conditioned about, keeping an open mind that actually this has been used as a medicine for so long, always has been, it is a medicine, it always will be. And that remains is that we have the physiology within us is about the cannabinoids and the endocannabinoids in our system. These
Yeah.
are, this plant is actually helping us replenish, helping us adjust that endocannabinoid system to get better health. And that's, so we need more education and awareness really across professionals, but the public, public as a whole too.
If someone's listening right now and they're a doctor, how can they become a prescriber? And do they have to go on a course and they get a special license? Like, how does that work?
So I'm a committee member of the Medical Cannabis Clinician Society, and on a monthly basis, their courses run to help educate would-be prescribers. It's really accessible, several hours. And that society as well supports prescribers with anything they want, really, in terms of support for patient, support for them when they're prescribing for patients as well.
Okay.
So it's a really good resource. We run regular webinars as well, grand rounds. So it's a great resource for education and very supportive too. Has like a Google group as well, so people can regularly access it 24 hours if needs be. It's supposed to run 24 hours, I think, because members across the globe. There's a lot of clinicians from other countries as well where medical cannabis has been legalized for many years, so Australia and Canada, for example. So they're very much ahead of the curve. We're a little behind in the sense that we need GPs prescribing this, but unfortunately, GPs can't prescribe this medicine. It's only left to people with secondary care. I say they can't prescribe it, they can't initiate a prescription. So GPs can continue prescriptions, but they can't initiate it, which
Okay.
in my mind is bonkers, because if anybody's struggling, where's the first port of call? Unless it's serious, really serious, then obviously the emergency department. But otherwise, they're going to primary care. And GPs see a whole host of things, and they prescribe lots and lots of drugs. However, at the moment, they're unable to initiate cannabis. That's different to other countries at the moment. They should be
It's
allowed to.
crazy. It's crazy. It frustrates me so much that the UK is behind in so many, so many ways. And I see this with ADHD. I speak to people from across the world who are, been ahead of us and ahead of the curve. What's interesting is that, and again, I'm not a doctor, so I don't know this for sure, but am I right in that GPs could probably prescribe stronger and more addictive sort of opiate-based medication than this, and probably more detrimental medication, and this could be a much safer option?
Absolutely. So GPs can prescribe opioid analgesics. They can prescribe benzodiazepines. They can prescribe many what we call psychotropic medications for mental health. So it really is unfortunate at this stage that we have a position where they're unable to prescribe because, one, I think we don't have enough people prescribing. Yeah, so there are not enough doctors. And all I can say is just reassure that actually it is a safe medicine. Like I said, we always want to keep people informed about potential disadvantages or side effects. But actually, ultimately, in my experience, the potential advantages outstrip any disadvantages. And we should be in a position and hope where GPs should be able to prescribe it, as has happened in other countries, because I think that is reducing the number of potential prescribers that can be out there.
What I'm wondering is that if we know again that addiction is very closely linked with ADHD, and so very often it's the addiction that's self-medicating the undiagnosed ADHD because we're looking for that dopamine hit or the self-regulation or the calming.
Yeah,
And so if people have had sort of addictions in the past, whether it has to, drink, alcohol, food, gambling, sex, shopping, this is not addictive. Am I right in saying?
that's right. Yeah, yeah. So a lot of people get worried that actually you can get addicted to it, but or you can build like tolerance to it as well. But in medically prescribed, actually, I've not observed those things happening. So I've not observed that people have become hooked on medical cannabis, or indeed needing large amounts of increases of the medication as you develop tolerance, which is basically what that means is that your body gets used to a certain amount of cannabis and you need more and more and more as time goes on. Um, Ultimately, there is always the potential risk of people who are accessing it on the streets to get potentially dependent on that. Again, that is because we've reached a position where potentially people are accessing high strength THC. Like I said, that can be potentially quite damaging and detrimental, particularly for people who, during the neurodevelopmental period as they're growing up, where your brain is much more sensitive. And so it's really, really important for people to be aware about potential for harm during the neurodevelopmental period of time, because especially for products that you don't know how they've been produced, don't come with any sort of vetted certificates of analysis or anything. So you don't exactly know what compounds are in there.
Yeah. There are very few options apart from just the holistic and the lifestyle and, looking after, our movement and nutrition and all these things are totally, they're valid, and we need to do that, especially alongside the medical cannabis. But we are hearing a lot that people are just kind of like lost in the system, or their titration's not working. And because of the way everything is, and the expense of having to titrate and go back for more consultations, people just think, I can't be bothered.
Yeah,
I can't be bothered to go through this whole process. It's actually making the diagnosis of my ADHD even more stressful. So I wonder if this is hopefully a more simplistic option for people.
exactly, absolutely. And the fact remains, as I mentioned, you're not having to do the observation side of things as well, and it fits in nicely with that whole integrative approach. So I always say to patients that cannabis is not the beginning or the end. Yeah, it's a platform. Yeah, for then you to do other stuff. So what people can find is that they're eating better, they're reducing alcohol consumption as well. Obviously, the sleep is better, so they can exercise more as well. And all these things actually influence the endocannabinoid system. So you're actually boosting it there. So any medication is just there to act as a platform to help leverage you to better lifestyle choices as well. And I think that that's what's really crucial for people to know, is that actually it is helpful and it can do, but it's not the full solution. At the end of the day, patients are accountable and responsible, and it's their own health at the end of the day, and they can actually help boost that by using cannabis can be helpful to help give them a boost to get on with other things day to day. And work is included as well. So many of my patients have actually managed to access employment because they feel in a state that they're able to get on with work. And I think that's such a fabulous outcome. And it's a great barometer, of quality of life when people are actually not being able to work for a long time. But actually, then they find themselves in a position where they're able to do all those lifestyle things and actually get into employment as well.
Yeah. And if you think about social anxiety, if people are struggling to find a partner, relationships, friendships, community, you like all of that, like so impactful on our health, all of
Yes.
this. And if we're struggling to leave the house, and this can help with social anxiety, that is a massive health boost, isn't it?
Exactly. I mean, a lot of people do struggle with socialization. That's right. It could be for variable conditions. But the fact is that social interaction itself can be medicinal. We know about the interactions from one person to another. The mirror neurons, oxytocin, the connection, all that kind of things as well. But a lot of people are unwell. They're withdrawn. They're looking inwards. They don't have the capacity to go outside. And actually, here is a potential. I've seen many people who have been, just stayed at home for months, even years, and they've just not had the ability to get out. And now more and more these days, we can order stuff online, so we kind of we can get stuff in and all that. But with this potential to help reduce that social anxiety to an extent where people are going out, they're starting to make friends, they're starting to build relationships.
Mm,
That's medicine, ultimately, isn't it? That's it.
absolutely.
So
Yeah, absolutely. So, what I'm hearing is that we can self refer, but we need to have a diagnosis, and we need to have tried medication that potentially hasn't quite worked to tick those boxes to come to you. What else? I mean, tell me if people are listening to this now and they're like, yes, I would love to try this. I am always very sort of open and honest that, this type of, we're still at the beginning stages, which means the affordability, the accessibility, unfortunately, is still quite expensive. And I know that prohibits a lot of people, and it's very frustrating when we're talking about this and going, yes, it sounds amazing. And then we realize what the cost is, and it's beyond people's, affordability.
yeah. Well, a lot of clinics these days now offer discounted appointments. So initial appointments could be an accessible cost anyway. Um, but yes, you're quite right, Kate, that actually it can be a costly process, really, in the sense that actually, on average, people might be paying anywhere between £250 to £300 a month, and it can vary from person to person, and how much they're using, etc. Actually, that's a lot of money. Prices have come down with ranges of products that are out there as well, and I'm hopeful that actually in time we'll see further price reductions as well There's also the ability for people to access kind of smaller amounts of products, which otherwise, they might come in certain sizes, where actually, they're actually smaller. They could be more cost effective. So I think there is an awareness actually that actually this can be quite cost prohibitive for many, and needs to be ways for people to be able to access this medication. It should be on the NHS, and I'd love to see a time when it will be accessible to people. There are medications which are produced for certain conditions, the MS or epilepsy, which are cannabis for those specific conditions, but not specifically for mental health and chronic pain. What we find is that medical cannabis can possibly save the NHS
Yeah.
billions. Yeah. So there's a recent study done on chronic pain where they evaluated and said that actually with the cost savings, it could be up to about, I think it was £4 billion a year could be saved just through medical cannabis. Now, if you think if somebody's been treated, actually they're getting to work, so they're contributing to the economy, it could potentially save the number of people going in for inpatient care, hospitalizations, be it to secondary care, hospitals or mental health hospitals as well. So there's a whole potential of savings that can be made.
Makes sense. We need some lobbyists. If there's anyone listening here and that you're interested in lobbying, then this is what we need. We need the pressure on. We need people like you who are, obviously very reputable in being a doctor, psychiatrist, to be able to say this is the future. And unfortunately, the NHS, as amazing as it has been, and a lot of the good work it does, it's still very much stuck in an archaic system that I don't think is working
Mm,
anymore.
yeah,
Especially what we're seeing with ADHD, very specifically, is that the people who are thriving are the privileged people, are the people who can afford the private diagnoses, the medication, the continuum of care, and the people who aren't thriving, who are waiting on these waiting lists for 4 to 5, 6 years, and then unable to continue the medication because of different things. And there's that disparity, which is why it empowers me so much to do this podcast, because I always think that awareness, education is power. We can go and advocate for ourselves to our GP, to our psychiatrist, and say, no, I'm not accepting that. There's other options. And this is why, this conversation is so important, that hopefully the more of these conversations and they're shared,
yeah,
then there's more kind of ammunition to lobby the government to really take this seriously.
100%, 100%. And I think really what we need to do is dispel assumptions about this medicine. Like I said, people need to unlearn. We need to get the education out there and really continue to build on the research and the evidence base that we have. So, Drug Science, which is a charity, is running what's called real world evidence studies to show the outcomes in various conditions, anxiety, even ADHD, chronic pain, PTSD, and they're really they put out some publications already which have shown some really favourable outcomes. Again, with very very few adverse effects as well. So if anyone's interested, I would definitely urge you to look at the Drug Science T21 study. Um,
Okay. I'll
real,
link to
real,
that. Okay. So, how can people get in touch with you? If you've got a website, tell me if people are saying, right, I want to try this, where can
yeah,
they go?
yeah. So I have my own website, so that's drnirajsingh.co.uk. I also work with a couple of other medical cannabis clinics called Integro and Medica as well. So people have got various ways in which they can get to see me as well. There are a lot of different clinics out there with different offers. What I do, just urge patients to do, is just have a look around, explore, do your research, and just get educated on it. Have a look at what information is out there in relation to that particular condition that you're struggling with as well.
Amazing.
There's also the Medical Cannabis Clinician Society website as well, which has got loads of fantastic information on there. So it will tell you information on accessing the medicine itself, the products, how it gets used, and also things like in relation to driving, travel, and that sort of thing. Issues that people might be a little bit, concerned about if they're having medicines. So things like driving, pregnancy, and travel abroad can be things that unnerve people. But again, just to reassure everyone that actually this is the way we see it. And I always say to patients too, because many of them are very, very worried about this, and why wouldn't they be? Because of criminalization historically, it's a medicine, and again, it always has been, it is, and it always will be. Using it as a medicine, and if you're using it responsibly, and you're using it in a way that augments your life, in a way that you're doing other things that helps your health, then there's no greater thing really than that.
Thank you. Thank you for explaining all of that. And I'll make sure that everything you've just sort of said are all in the show notes so people can go there, really do their own research, check it out. Like you say, really understand how it impacts all those variables. But this has been absolutely fascinating. And thank you so much for coming and explaining it all. And yeah, I really hope that, in a few years, we're going to look back in this conversation and go, oh, can't believe that's where we were, and look at the progress now.
Yeah,
so that's what I believe. I believe this will be the future, alongside lots of other more sort of holistic based practices as well. So Dr. Niraj Singh, thank you so much for being here.
Oh, thank you very much, Kate. It's been a real pleasure.
If you've enjoyed today's episode, I invite you to check out my brand new subscription podcast called The Toolkit. Now, this is where I'm going to be opening up my entire library, my vault of information from over the years, my workshops, webinars and courses, my conversations with experts about hormones, nutrition, lifestyle, and bringing brand new, up-to-date content from global experts. This is going to be an amazing resource for you to support you and guide you even more on more niche topics and conversations, so you can really thrive and learn to live your best life with ADHD. I'm so excited about this. Please just check out, it's The Toolkit on Apple Podcast, and you get a free trial. Really hope to see you there.